When we think of beauty treatments and anti-aging procedures, Botox might be the first thing that comes to mind. Thanks to social media, younger people are bringing it back to the conversation, wondering if it's safe, if it's worth it, how long it lasts, and what are some possible side effects. In this video, we'll talk about what Botox is, how it works on your body, and what it's used for. Hopefully, this will help you better understand the treatment and whether it's a good option for you if you have been thinking about getting Botox injections lately. Hi everyone! Welcome back to our channel. My name is Dr. Xiang from SL Aesthetic Clinic, and today we'll talk about botulinum toxin, commonly known as Botox. If you're considering getting this treatment but are scared of the possible side effects, you are not alone. Later in the video, we'll look into some Botox gone wrong cases to understand what happened and how to prevent those undesired outcomes. Botox is a drug made from a toxin produced by the bacterium Clostridium botulinum. Botox injections use this component to weaken muscle contractions. This helps prevent wrinkles from becoming more profound and even reduces their appearance. The drug is injected in key points in the skin where the effects of the toxin can be maximized to result in a more youthful and smoother appearance. Let's take a closer look at how this works. One of the most common misconceptions is that Botox works on the skin, but as I mentioned before, it works on the muscles directly. This misconception probably arose because the muscles of the face are often closely related to the skin. The active ingredient in Botox is the botulinum toxin type A, which is a muscle relaxant. It blocks certain nerve signals, preventing the muscles from contracting. Over time, the toxin will wear off and the muscles will be able to contract again. These effects can last for about 3 to 6 months depending on the area that you are treating. The amount of Botox that's injected will depend on the area treated. Variations in dosage may exist between individuals. Botox comes in dosages between 50 and 100 units per vial. On a regular first-time procedure, the forehead, for example, could take 8 to 20 units. Crow's feet could need 5 to 15 units, and frown lines could take 10 to 25 units. It all comes down to the patient's needs, as well as the size and strength of the muscles. According to the US FDA, the safe dose of Botox is 400 units within a 3-month period. Botox relaxes the muscles that cause wrinkles, but erasing them completely depends on the severity of the wrinkles. Dynamic wrinkles that disappear when the face is at rest will respond best to Botox treatments. On the other hand, static wrinkles that do not disappear when the face is at rest, which signifies that there is a loss of collagen and elastin at the dermis. Such wrinkles may not fully resolve with Botox treatments alone and may require combination treatments with other modalities. Dynamic wrinkles can turn into static wrinkles if not properly taken care of. Hence, Botox is best done as a preventive rather than a restorative treatment. It is not surprising that many celebrities start getting Botox treatment when they are still young. It's normal to have some concerns about getting Botox given what you might have seen on social media. However, when it's administered correctly, the results can be truly amazing. So let's check out a few cases where things didn't go very well to understand what went wrong and how to prevent similar issues.
So did you all know that you can get Ptosis?
Eyelid ptosis. This is probably caused by the Botox reaching the muscle called the levator palpebrae superioris. That's the muscle that lifts up and opens up the eyelid. So sometimes this can be due to injecting somewhere out of the safe area, or even if the Botox was injected in the correct area, some excessive rubbing might have shifted the Botox to the wrong place. There are some medications that can help with this, but the effects are temporary and the effectiveness is not guaranteed as well. Worst case, wait for about 3 to 4 months for the effect of Botox to wear off and the eyelid will go back to normal again.
My journey with getting
Alright, her mouth. It seems like this lady wanted to treat the downturned corners of her mouth, so the injector was supposed to inject into this muscle called the depressor anguli oris, but sometimes if the injection has gone too deep in or too much to the middle, when the Botox went to another muscle called the depressor labii, and that resulted in the whole lid drooping downwards. So one quick fix would be to go to the other side that's not affected and inject the depressor labii to make both sides symmetrical. Well, the good news is after 3 to 4 months, when the Botox effects wears off, the lips will go back to normal.
Okay, ready? Relax your brows.
Mr. Spock from Star Trek. So this is the Mephisto sign, or also known as Spock's brows, which is named after the character Spock from Star Trek. It is due to Botox at the middle part of the frontalis muscle. This is the muscle that raises the eyebrows, and there's an unequal amount at the tails of the eyebrows. So while this part of the eyebrows cannot be lifted up, this part is excessively lifted up, and this gives a very surprised look. What we can do is just to put a few units here and here to lower the two tails of the eyebrows and make it more equal. The truth is that Botox has many uses beyond preventing and alleviating wrinkles. Botox injections are also used to ease symptoms of some health conditions. It can help reduce excessive sweating, muscle spasms, and even improve lazy eye. It's also been used to treat migraines and urinary incontinence issues. Botox is not a cure for any of these conditions, but it can help many patients with the symptoms. That's everything we have for today's video. I hope you now have a better understanding of how Botox works and what it can do for you. Before you go, make sure to give us this video a thumbs up if you found it valuable, and remember to subscribe to our channel for more professional insights for all things beauty and skincare. Thank you so much, and I'll see you next time.